if there is a persistent infection, or there is a DNS, and there is a continuous exposure to irritants, and there is vasomotor rhinitis or endocrine disorders such as hypothyroidism, then the patient is having recurrent and recurrent infection that converts a simple acute rhinitis to the chronic rhinitis. Symptoms are prolonged, or there is supervening of bacterial infection, then it also causes the chronic simple rhinitis. Basically, I'm telling you one thing, that it is the early stage of hypertrophic rhinitis. So in our next video, we'll talk about the hypertrophic rhinitis. Then what is the hypertrophic rhinitis? Basically, in the chronic simple rhinitis, we have studied the causes, that there is persistent infection, DNS, irritants, or vasomotor rhinitis, or endocrine disorders such as hypothyroidism. Okay, now let us move towards the we have discussed about the causes. Now let us move towards the pathology of the chronic simple rhinitis. In pathology of the simple rhinitis, we simply see the edema and hypertrophy and hyperemia of the hypertrophy is less. Okay, in chronic simple rhinitis, hypertrophy is less, but when it moves towards it is basically the early stage of hypertrophic rhinitis, in which the hypertrophy is very marked. Hypertrophy of the turbinates. So in chronic simple rhinitis, simply seen the edema of the glands, mucous glands, or we see the hyperemia, like redness there at the turbinates, and then it progresses towards the hypertrophy of the turbinates. Then we are going to discuss about the signs and symptoms of the signs and symptoms of the chronic simple rhinitis. Basically, all rhinitis are having the same symptoms. There are postnasal drip, headache, discharge from the nose, all are common. The additional feature is swollen turbinates. As we have discussed in its pathology, that there is hyperemia and edema of the glands. Then we will discuss about the treatment of the chronic simple rhinitis. Okay, brainstorm and tell me what is going to be the treatment of the chronic simple rhinitis. Obviously, it is due to bacterial infection. We give the antibiotics. We give antibiotics. Then we give nasal decongestants, pseudoephedrine, etc. Then alkaline solutions. And then avoidance of particular cause. Like if there is DNS, we should correct the DNS. If there is irritation, we should avoid the irritants, etc. So avoidance of irritants, antibiotics, nasal decongestion such as pseudoephedrine, and alkaline solutions, alkaline agents are helpful in the treatment of the chronic simple rhinitis. Obviously, you have told me about the antibiotics, and all of the rhinitis treatments are same, like nasal decongestion and irritants are included in almost all the rhinitis. And if there is bacterial infection, about the treatment of the chronic simple rhinitis. Now I'm going to discuss about the hypertrophic rhinitis. Hypertrophic rhinitis is basically the condition after the chronic simple rhinitis when there is hypertrophy of the mucosa, simply hypertrophy of the turbinates mucosa, and it is very prominent. And hypertrophic rhinitis, we already know the cause of the hypertrophic rhinitis, that the chronic simple rhinitis progresses towards the hypertrophic rhinitis. And what are the causes of the chronic simple rhinitis? Recurrent nasal infections. The causes of both of them are same, that recurrent infections, DNS, continuous exposure to irritants, etc. What are the signs of the hypertrophic rhinitis? You tell me. There is hypertrophy, obviously, and hypertrophy is marked in the inferior turbinate. Inferior turbinate. Inferior turbinate, there is hypertrophy. Then we have covered about the hypertrophic rhinitis. Its causes are same as chronic simple rhinitis. Then we have covered its signs. Signs are basically the hypertrophy, obviously. Then what is the treatment? Obviously, the turbinates are hypertrophied. They're very large. So, in attempt to shorten them, we cautery them. Cautery means that cauterization. Treatment. In treatment, we cautery them. Cauterization. SMR. Submucosal resection. Then cryosurgery or through laser ablation, laser ablation. We remove them. Basically, the turbinates are very large. We remove them by the different methods such as cauterization, SMR, submucosal resection, cryosurgery, and laser ablation. The topic that is compensatory hypertrophic rhinitis. Now, what is compensatory hypertrophic rhinitis? Suppose this is my nose and my nasal septum is deviated. So one part of the nose is having a greater surface area, more air currents, development of crust there. In order to compensate this surface area, the turbinates here gets enlarged. Again, if the nasal septum is deviated towards one side, then there is the compensatory hypertrophy of the turbinates on the other side, and that is basically the mechanism or pathology of the compensatory hypertrophic rhinitis. Then moving towards this or ozonia. It is chronic atrophy of nasal mucosa turbinates. If the patient come to you with the foul smelling or having the nasal crust, then this is the case, or the patient is female, then this is the case of the atrophic rhinitis. So basically in atrophic rhinitis, we have the complete atrophy of the nasal mucosa and turbinates and foul smelling nose. Etiology, you can remember it by the mnemonic hernia. Hereditary factor, endocrine disorders, puberty in girls. It is related to basically the hormones, so endocrine disorders. And then racial factors, and then nutritional deficiencies such as vitamin A and iron deficiencies, infections, and autoimmune or idiopathic. So this is its etiology. You can remember it by the mnemonic hernia. Hereditary factor, endocrine disturbances. It is if a girl or a female comes to you with the foul-smelling nasal discharge, or she is having crust in the nose, then this is the case of the atrophic rhinitis. Racial factor, nutritional deficiency, infections, and autoimmune disorders. So what is pathology of the atrophic rhinitis? Basically, our nose is lined by ciliated columnar epithelium. So ciliated columnar epithelium is replaced by the stratified squamous epithelium. Stratified squamous epithelium replace the ciliated columnar epithelium. And there is obviously atrophy of the glands and nerves and at all the elements, arteries there. And in atrophic rhinitis, as there is atrophy, loss of ciliated epithelium, it is replaced by the stratified squamous epithelium. Loss of all the structures. Obviously, turbinates are lost, resorption of turbinates, and ultimately the nose is having the largest surface area. Obviously, if turbinates are lost, then surface area become large. So its pathology is clear. Then move towards the clinical features. Clinical features seen in young females after puberty: wide nasal cavities with crust, insomnia or foul smelling. It may present with the saddle nose, dry pharynx, eustachian tube dysfunction, and hearing loss. Then what is its treatment? Moving towards the treatment. Treat so now towards the treatment of the atrophic rhinitis. Treatment. In treatment, we first of all give nasal irrigation. Irrigation. And how we give it? By dissolving the sodium bicarbonate 1 part and sodium biborate also 1 part, and then sodium chloride 2 parts in 280 ml of water. So how we do the nasal irrigation? By dissolving sodium bicarbonate 1 part, sodium biborate 1 part, sodium chloride 2 parts in 280 milliliter of water. 280 ml of water. So first step is nasal irrigation. The next second one is 25% glucose in glycerine solution we use. In third, we use antibiotics, obviously. Antibiotics. Also, it is related to hormonal, so we use hormonal factors, so we use estradiol sprays. Estradiol sprays. And then we also use placental extract, streptomycin, and potassium iodide. Nasal irrigants, 25% glucose in glycerine, antibiotics, estradiol spray, and placental extract and potassium iodide. This is the treatment of atrophic rhinitis. Then move towards another topic, this is the medical or management or conservative management, you can say. So what is the surgical management? Above one is the pharmacological management. Now moving toward the surgical management, we have two operations: Young's operation and modified Young's operation. What is the difference between the Young's operation and modified Young's operation is basically, in modified Young's operation, we partially close the nostrils. Partially close. My partially is looking so weird. So we partially closed. Partially close the nostrils. Okay. So this is the difference between the Young's operation and modified Young's operation. In Young's operation, we completely close the nostrils. I'm not going into details of these operations because I'll discuss with you in the next lectures. So long story short, Young's operation and modified Young's operation, the basic difference is that in modified Young's operation, we partially close the nostrils, and in Young's operation, we completely close the nostrils. So we prefer modified Young's operation over it. And we can also do, this is all about the surgical management, we can that the surface area increases after the atrophy due to the atrophy of the turbinates. So how we deal with the greater surface area, or how we deal with it? We place the Teflon paste inside the nasal cavity to narrow the nasal cavity after the atrophy of the turbinates. Then we insert fat cartilages, etc. Insert fat or cartilage, etc. And we can also simply displace the lateral wall of the nose medially. So this is how we deal with the greater surface area that is due to the atrophy of the turbinates. Then there is a term called secondary atrophic rhinitis. Secondary atrophic rhinitis. What is that? Secondary atrophic rhinitis is due to the conditions such as lupus, syphilis, lupus, and rhinoscleroma. Scleroma. So this is the cause of the secondary atrophic rhinitis. In it, also, there are some other causes except the microorganism. There are some other causes such as during the radiotherapy or excessive removal of the surgical removal of the turbinates during turbinectomy also causes the secondary atrophic rhinitis. That is not due to the primary cause, that is due to some other cause other than the atrophy of the turbinates. Syphilis, lupus, rhinoscleroma causes the atrophy of the turbinates, and they also there when there is excessive surgical removal of the turbinates during turbinectomy, it also causes secondary atrophic rhinitis. Then we have another term, that is rhinitis sicca. What is rhinitis sicca? It is seen in patients who work in a hot and dry atmosphere or dusty atmosphere, such as bakers, irons, and goldsmiths. This condition is confined bakers, iron, goldsmiths, bakers, irons, and goldsmiths who work in hot environment. Okay. Condition is confined to the anterior part of the nasal septum. Rhinitis sicca, basically it is confined to the anterior part of the nasal septum, and in it there is squamous metaplasia. Means that ciliated columnar epithelium is replaced by the squamous epithelium. Sicca, we treat it with the help of antibiotics. How we treat rhinitis sicca? We treat it with the help of antibiotics. We give antibiotics to the patient. Avoidance of factor. Avoidance of factor such as the rhinitis sicca is basically due to the hot and dusty environment. To avoid the environment and change of occupation really relieves the disease. And again, nasal irrigation. So this is the treatment of rhinitis sicca. In rhinitis sicca, we have discussed about its causes. Its causes due to hot and dusty environment. Its pathology in it. There's squamous metaplasia. And treatment, antibiotics, avoidance of the factors, and nasal irrigation. Then moving towards our next topic, that is rhinitis schizosa. Now moving towards our another topic, that is rhinitis schizosa. If a patient comes to you with the complaint of offensive purulent discharge and the nasal cavity is filled with the cheesy material, then obviously this is the case of the rhinitis schizosa. Basically, in it, sinus mucosa become granulomatous. So how we treat the condition? If a patient comes to you with a complaint of offensive purulent discharge and there is a cheesy material inside the nasal cavity and their nasal mucosa is granulomatous, you may misperceive it as a malignancy, but this is not the malignancy. This is simply rhinitis schizosa, and how you treat it? Simply removal of the debris. We remove the debris in its treatment, and drainage of the sinuses. Simply remove the debris and drain the sinuses. Remove debris debris, and drain the sinuses. So that is all about our today's lecture.